19 Things to know about colorectal cancer. Colorectal cancer, also known as colon cancer or bowel cancer, is a serious condition that can be fatal if not detected and treated early. While it is more common in older adults, there is a growing number of younger people being diagnosed with this disease. 1. What is colorectal cancer? 1. What is colorectal cancer? Colorectal cancer develops when abnormal cells grow and multiply in the lining of the colon or rectum. Both men and women are at risk. According to the American Cancer Society, colorectal cancer is the third most common cancer diagnosed in both men and women in the United States. The good news is that with early detection, colorectal cancer is highly treatable. 2. What are colorectal polyps? Colorectal polyps are growths that form inside the colon. Most polyps are benign non-cancerous, but they can become cancerous if left untreated. 3 types of colorectal polyps. Adenomatous polyps. These are the most common type of polyp and have the highest risk of becoming cancerous. Hyperplastic polyps. These polyps are usually harmless. Inflammatory polyps. These polyps form as a result of inflammation in the colon. 3 types of colorectal polyps. Villus polyps. These polyps are less common but are more likely to become cancerous than other types. 4 risk factors for colorectal cancer. Age. The risk of colorectal cancer increases with age. Family history. If you have a close relative who has had colorectal cancer, you have a higher risk of developing it. Diet. A diet high in red meat, processed meat, saturated fat, and low in fiber can increase the risk of colorectal cancer. 4 risk factors for colorectal cancer. Obesity. Obesity is a risk factor for colorectal cancer. Smoking. Smoking increases the risk of colorectal cancer. Diabetes. People with diabetes have a higher risk of developing colorectal cancer. 4 risk factors for colorectal cancer. Inflammatory bowel disease. Inflammatory bowel diseases like Crohn's disease and ulcerative colitis can increase the risk of colorectal cancer. Previous history of colorectal polyps. Having had polyps removed previously increases the risk of developing colorectal cancer. 4 risk factors for colorectal cancer. Personal history of certain cancers. Those who have had breast, uterine, or ovarian cancer have a higher risk of developing colorectal cancer. 5 symptoms of colorectal cancer. Changes in bowel habits. Diarrhea, constipation, a change in the consistency of your stool becoming more watery or harder than usual. Blood in the stool. This can be bright red or dark and may appear as streaks or tar-like. Abdominal pain. This can be mild or severe, and may come and go. 5 symptoms of colorectal cancer. Unintentional weight loss. Losing weight without trying. Fatigue. Feeling tired all the time. Bloating. Feeling full or bloated after eating. Nausea and vomiting. Feeling nauseous or vomiting. Fever. A low-grade fever. 6. How to prevent colorectal cancer. Maintain a healthy diet. Limit red meat and processed meat. Eat plenty of fruits, vegetables, and whole grains. Get regular exercise. Being physically active can lower your risk of developing colorectal cancer. 6. How to prevent colorectal cancer. Get screened for colorectal cancer. Regular screenings, such as a colonoscopy, can help detect colorectal cancer in its early stages, when it is most treatable. 6. How to prevent colorectal cancer. Get vaccinated against HPV. While the HPV vaccine primarily protects against cervical cancer, it can also help reduce the risk of anal cancer, a form of colorectal cancer. 7. How colorectal cancer is diagnosed. Colonoscopy. This is the most accurate way to diagnose colorectal cancer. It involves using a flexible, lighted tube with a camera to examine the colon and rectum. Fecal occult blood test. FOBT. This test checks for blood in the stool. 7. How colorectal cancer is diagnosed. Sigmoidoscopy. A shorter version of a colonoscopy that examines the lower part of the colon. Computed tomography. CT scan. A series of X-rays used to create detailed images of the inside of the body. 7. How colorectal cancer is diagnosed. Magnetic resonance imaging. MRI uses a powerful magnet and radio waves to create images of the body. Biopsy. If a polyp or growth is found, a small sample of tissue will be removed for examination under a microscope. 8 treatment options for colorectal cancer surgery. The most common treatment for colorectal cancer involves removing the cancerous area and surrounding tissue. Chemotherapy uses drugs to kill cancer cells. Radiation therapy uses high-energy X-rays to destroy cancer cells. 8 treatment options for colorectal cancer. Targeted therapy uses drugs to target specific proteins or genes in cancer cells. Immunotherapy helps the body's immune system fight cancer cells. 9 stages of colorectal cancer. Stage 0 cancer is only in the lining of the colon. Stage I cancer has spread to the layer of tissue beneath the lining of the colon. Stage 2 cancer has spread to nearby lymph nodes. Stage 3 cancer has spread to other organs. Stage 4 cancer has spread throughout the body. 10 survival rates for colorectal cancer. Survival rates for colorectal cancer depend on the stage of the disease, the type of cancer, the person's overall health, and the treatment received. Early detection is crucial for improving survival rates. The 5-year survival rate for localized colorectal cancer stage I is over 90. 11. How colorectal cancer affects health. Colorectal cancer can lead to a range of complications, including bleeding. Blood in the stool is a common symptom of colorectal cancer. Bowel obstruction. A large tumor can block the colon, causing nausea, vomiting, and severe abdominal pain. 11. How colorectal cancer affects health. Bowel perforation. A tumor can cause a hole in the bowel, leading to a life-threatening infection. Increased risk of other cancers. Colorectal cancer can increase the risk of other cancers, such as liver cancer and lung cancer. 12. The importance of early detection. Early detection is vital for successful treatment of colorectal cancer. Finding the cancer early allows for more effective treatment and improves the chances of survival. 13. Diet and lifestyle changes for people with colorectal cancer. Eat a balanced diet. Follow a healthy eating plan that emphasizes fruits, vegetables, and whole grains. Limit red meat and processed foods. These foods can contribute to the growth of cancer cells. Stay hydrated. Drink plenty of water. 13. Diet and lifestyle changes for people with colorectal cancer. Maintain a healthy weight. Losing weight can improve overall health and may help reduce the risk of colorectal cancer. Get regular exercise. Aim for at least 30 minutes of moderate intensity exercise most days of the week. 14. What to expect during treatment. Side effects. Cancer treatment can cause side effects such as fatigue, nausea, hair loss, and mouth sores. Support. Seek emotional and practical support from family, friends, and support groups. Recovery. The recovery process after treatment can vary depending on the type and stage of cancer. 14. What to expect during treatment. Follow-up care. Regular follow-up appointments with your doctor are essential for monitoring your health and detecting any recurrence. 15. Understanding the difference between colon cancer and rectal cancer. Colon cancer develops in the colon, the larger part of the large intestine. Rectal cancer develops in the rectum, the lower part of the large intestine. 16. Lifestyle changes to reduce risk. Limit red and processed meat. These can increase the risk of colon cancer. Increase fruit and vegetable intake. These provide essential nutrients and fiber, which may help protect against colon cancer. Choose whole grains over refined grains. Whole grains are higher in fiber. 16. Lifestyle changes to reduce risk. Maintain a healthy weight. Losing weight can lower the risk of developing colon cancer. Quit smoking. Smoking is a major risk factor for colon cancer. 17. Importance of regular screenings. Early detection. Regular screenings are crucial for detecting colon cancer early, when it is most treatable. Preventative measures. Screenings can help identify polyps, which can be removed before they turn cancerous. Peace of mind. Screenings can provide reassurance about your colon health. 18. The role of genetics. Genetic testing. Certain genetic mutations, such as Lynch syndrome, can increase the risk of colon cancer. Family history. A strong family history of colon cancer may warrant genetic testing. 19. Conclusion. 19. Conclusion. Colorectal cancer is a serious disease but can be effectively prevented and treated with early detection. By maintaining a healthy lifestyle, getting regular screenings, and seeking prompt medical attention if you experience any unusual symptoms, you can significantly reduce your risk of developing this cancer.